Hi everyone, and welcome to the 45th episode of Allison Voices. I'm Latika and I'm the founder and host of Allison Voices.
And I'm Camden, and I'm the co-host, and we serve on the executive team of Vitals and Voices.
Battles and Voices bring together generations of people involved in healthcare in order to foster a supportive and inclusive community.
Please welcome our guest, Sharon.
Thank you so much for being a part of this episode. We're so excited to have you today to join us on Battles and Voices. Start off to kind of introduce yourself and share a little bit about what you do.
Yes, hi everyone. My name is Sharon. I am a senior at Rutgers University, Newark, majoring in neuroscience and minoring in social justice. I'm on the pre-med track. Currently, I'm applying to graduate school before medical school because I feel like I would like to target some areas before applying straight through. So, yeah, if you have any questions on that too, I can feel free to answer.
Alrighty, and with our first question, can you tell us a little bit about your journey as a neuroscience major on the pre-med track at Rutledge, Newark? I'm sorry if I said that wrong.
Okay.
And and what your current roles are looking like there.
Yes, so at Rutgers, I first started as a bio major. I didn't declare my major yet, but as a pre-med, you just decide, oh, I'm just gonna do bio. Because obviously it's the classes you need to take for the MCAT. So I decided since everyone else is doing it, why not? But then later on, I met some other upperclassmen at Rutgers who would have different majors such as psych, neuroscience, or similar sciences like chemistry. And so I was intrigued by knowing why people decided to take other majors. And some other people that I also met had, art majors or minors, and I just thought that was really interesting. So later on, the more I digged into it, the more I realized that I do like psych and I like neuroscience more. I took a neuroscience course and I absolutely loved it, so I decided to major in neuroscience. Even though it's not the traditional major that you do for pre-med, but it's something that every time I would hear upperclassmen talk about why they majored in it, I want to take classes that I'm interested in because the money's coming out of my pocket. So I'd rather learn something that I really want to do. And then obviously take some prereq classes that you need for the MCAT and for medical school.
Definitely agree. And neuroscience seems really interesting as well. So you mentioned that your interest in medicine began during the COVID-19 pandemic. Can you share how that experience kind of helped you shape your decision to pursue a career in healthcare?
Yeah, so it was my junior year of high school. We were obviously on lockdown mode. And during that time, I didn't really know what I wanted to do, like after I graduated high school. Most of my friends already decided what they wanted to do, where they wanted to go and everything, but I was kind of just stuck. Until the COVID-19 pandemic hit, and that's when I really saw the healthcare system at its best. And having a lot of family members back in Peru and seeing how healthcare is managed over there too, and like places like South America, being corrupt. And so, um, the more I saw injustices and inequalities in the way that people get healthcare, especially people who don't have citizenship or don't have the money, the resources to be able to access healthcare in America. I wanted to do something about it. And so that's when I started looking into healthcare, medicine. And obviously, the first thing that your parents say is like, just be a doctor then. And I took it with that approach, but then ended up loving medicine the more I started to look into as a freshman in college. And then I got a job as a medical scribe in my freshman year, and that really solidified my decision to go into medicine and become a physician.
Spoken about your family's background and experiences as an immigrant influenced your perspective on medicine. How has that shaped the kind of physician that you hope to become later on?
So I feel like seeing a lot of my community members, every time I shadow physicians in underserved communities, I see that a lot, that, it really reflects my family. people who are immigrants, people who come from underserved communities, different color skin, don't speak English. So all of these factors kind of make me think on how important it is to be an empathetic physician and have empathy drive you in your mission. So I see many physicians in these communities who really decide to help beyond the clinic room, sharing resources, applying their leadership skills and advocacy to really help their patients manage the healthcare system when they can't do it on their own. And obviously, it's not just physicians, but it's a whole healthcare team. So it really shows how empathy is one of the biggest skills factors that you need to have as a physician, and it's the type of physician that I hope to be one day.
I really love that, Sharon. So, you mentioned before that faith plays a big role in your life and your motivation. How has your faith helped you navigate challenges along the pre-med journey?
Oh, it's helped me a lot. I mean, I'm not the type of person who um kind of like uses like other things to motivate me, but like it's mostly about my purpose and like my journey and how I want to go about being the type of person that I want to be as a career woman, but also in my personal aspect. So I really merge those two things together every time I make a decision on a certain opportunity or a new role that I'm going to be beginning. And I take into account all of the things that make me me. And I think it's really important to have different values and grow in other areas of your life besides just professionally. Because I know we want to get somewhere, we want to have a career, we want to have a stable job, we want to be this type of person in society, but it's not just that, but it's also feeding other areas in your life. And for me, that's been faith, feeding into my religious journey, knowing where God wants me to go. So I think just having that person by my side spiritually and my family members too really helps me stay motivated. And it's really helped me continue on this journey because it gets so difficult so quickly. So you need to have supportive people by your side.
That's amazing to hear, and I'm glad that your faith has been that motivator and also just allowing you to connect with others as well. And you said that you're also passionate about serving the underserved communities. Why is it why is it important to you on improving the access to healthcare in these communities?
Yeah, so like I was talking to before, I've shadowed a lot of physicians in underserved communities. I come from an underserved community, and currently I'm attending a school at Rutgers, Newark, which is an underserved community. So just being around these communities and these types of people and seeing how important it is to really take care of them because there's not a lot of resources. A lot of people are living poverty. They don't know how to access the healthcare system or even manage their finances well. So it's very difficult for people who don't understand or don't know how to go about their day-to-day lives. So even just, targeting their health is one thing that they don't have in their brains all the time. Like it's not a priority, but mostly like bringing food to the table, making sure your family members have what they need to survive. So it really brought a new perspective to me on what type of physician I want to be in the future. And that's the type of person that I want to be. I want to be someone who serves people who can't serve themselves because, we're going to be the future voices. We're the ones who are going to be taking the roles and the leadership and responsibilities of our community members. And it's where you want to go and who you want to serve. So that's why I think it's really important to analyze what are your values and where you want to get in life. And these are where I want to go and how I want to serve.
I love how you're trying to improve access to healthcare in those underserved communities. I think it's really important, and I think every physician should kind of, emphasize that in their role as a physician. Yeah. So you currently work as a case manager and are shadowing a family medicine physician. What have these experiences taught you about patient care?
So these roles are relatively new. I want to say I had a long time doing them, but very recently just being able to start these new roles in clinical work. Like I know I've shadowed in the past, I've been a medical scribe, but I always strive to know, to get new roles or like new perspectives and see what else there is in healthcare. And healthcare is huge. So like, just having different perspectives. So going back to your question, I think these two experiences have definitely solidified what type of physician, like in terms of specialty, because it's not just about, general physician, but you have like surgical specialties or all these other specialties that you can go into. And I know it might change in the future. Like I'm still an undergrad, so like I still have med school to go through and then residency. But I really want to do family medicine as of right now. And these two roles are in family medicine clinics. And I just see like how great it is to me. Everyone has a different opinion, but to me, I really love family medicine. I've seen it in action. I see how all the nurses, the med students, the physicians work together for a single goal and to make sure that the patient has what they need by the end of their appointment. So as a case manager, what I do is I just give them the resources that physicians don't give. So the physicians and the medical students, they target the healthcare aspect on their own health, and the clinical side of things. And as a case manager, I give more of the resources. Like once they leave, they got to make sure they take their medications. They got to make sure they go get this subscription at this pharmacy. I give discounts so they can get these coupons and, have more resources and have to waste less money. So it's about what happens after the care and making sure that the care is still there once they leave the room. So I think it's a whole team. And I really love that family medicine or general medicine in general, they work as a team and really help the patients move forward with their healthcare plan outside of the hospital.
I'm so glad that you got to experience those patient care experiences. And you were also involved in research at, I'm probably going to pronounce this wrong, the Icahn?
Yeah.
No.
Okay. Yeah.
Icahn. Tell us a little bit about the research that you were working on and what you learned from it.
Yes. So I started this role in September, during the fall semester, and I met with this physician. Well, she's not a physician, she's a doctor, but she got her MPH and her PhD, and now she works at Mount Sinai. And upon going to a conference and meeting her and really seeing how her research in cancer research, but also epidemiology and public health all relate to the type of person that she goes about in teaching and also doing research to improve the quality healthcare in the hospital icon. I really got interested, and so I wanted to learn more because I've always wanted to go into cancer research. I find it very fascinating, but also it's an ongoing disease that, there is no cure to, and it's very complex. So I wanted to learn more and do research in it. And so I started this role in September, and I really enjoyed learning about cancer, just like the biology aspect, but then moving into the epidemiology aspect of things. And epidemiology is basically the study of communities and healthcare setting. So there's a lot to do with that. And I hope to get my MPH, my master's in public health in the future. So epidemiology is something I definitely have to start learning and implementing. And so just getting this research opportunity to learn more about it before I even get my MPH was really big. And the research that I am currently working on is just what's it called? So analyzing databases of clinical trials, and these clinical trials are mostly on cancer, people who have prostate cancer, and there is this new genetic what's it called? Like a genetic thing that you can like identify. So whenever people go for their PET scans, or go for their other scans, they can see this activate thing and you can see it, like it illuminates. So once it illuminates in the scan, it means that they have cancer in that area, and it's called PSMA. So this PSMA gene activator, is kind of how we can tell who has cancer in certain areas. But it's mostly used just for prostate cancers down there. But now we can see that it lights up even for people who have lung cancer. So having this new, thing that we can use to maybe target lung cancer patients is a new thing that we can identify, and maybe it could be used in hospitals. So that's kind of like the innovation kind of research I'm looking into and what we're doing and working on. But yeah.
I love that. And I was just speaking to another guest, and she is currently a master's of public health candidate. So it's really cool how you want to do that in the future. So outside of academics, you're involved in LMSA and serve as the president of the LMSA Plus chapter. Could you kind of explain what LMSA is and what that leadership role means to you?
Yes, so LMSA stands for the Latino Medical Student Association. I'm Latina, so upon hearing about or learning about this organization, I looked into it more. And it was, I think, my sophomore year of college that I first heard of it. But most students don't hear about it until med school. And I know some other undergrads who also learned about it early on, but usually it's a big organization that's focused on medical students who are Latino or come from Latino backgrounds, or want to help Latino communities. So it is very Latino based, but honestly, anyone can join because the resources that they offer are great. They offer scholarships, they offer help for the MCAT and leadership positions that you can join. And they all also, one of the biggest things that really brought me to this organization was all of the conferences that they host. And I was able to attend two conferences, I think, in the regional base. So yeah, that was like my sophomore year and junior year. And now this year, we're going to be attending another conference. So I'm happy that we'll be able to bring our undergrads, pre-med members to this conference too. But being in the role of president and previously being in the role in the regional team, I just love this organization so much. And it means so much because I see people who want to become physicians, and we even meet medical physicians who are already doctors who are Latino and look like us, and really strive to advocate and become leaders of healthcare because our communities really need it and representation matters a lot. So making only 6% of Latino physicians in all of the US is a very low number compared to the many, like the 13-14% of Latinos patients that exist in the United States. So we really got to make sure that this number goes up. And I make sure that in my institution and in my roles as LMSA president, and hopefully in the future getting more involved in LMSA, I strive to bring these numbers up and help other students, inspire other students so they can also join LMSA and be change makers to our communities because we need more Latinos.
That's so beautiful, and I love that you were able to join LMSA and the community from that because me and Latika are both in a lot of extracurriculars ourselves. So that's amazing. And also I just love the community from extracurriculars as well. Now, sadly, with graduation coming up in May, how are you feeling about this transition and what are you most excited for moving forward?
Oh, it feels so surreal because I still remember the first day of like my freshman year, coming in and like just going back and like seeing how much I've changed. And you guys too, like when you start college, you'll be sprouting and be spreading out wings and seeing all these, becoming a better person for yourself, but also becoming the people that you want to be. So for me, I think I'm mostly excited that hopefully I'll be starting graduate school by the time I graduate. And then taking a few gap years before applying to medical school. But I really want to enjoy the gap years. Like I don't want to be stuck just doing lab work or stressing about classes or the MCAT. Like obviously those are things I will have to do, but I want to enjoy my gap years. I want to make sure I travel, that I spend time with family and really grow in other areas, because you only have one life, and you're never going to be in your 20s again. So really want to make sure I enjoy my 20s after I graduate. But it is sad because the time went by super fast. So really enjoy your time in college when you start.
Thank you so much. Yeah, it definitely feels so surreal that both me and Camden are graduating this May and like totally starting new chapters of our life, maybe in the same state or different states. So, yeah. And to wrap things up, what advice would you give to students, especially first generation or Latino students who are considering a career in medicine?
I would say to first get support, get a community that can really support you or people. It doesn't, community doesn't just mean like a big group, but it can simply mean like the people who surround you and really want to help you in your journey. Because even like I've had a lot of support from my roommates, people who I wouldn't have thought that could really help in my journey as medical, like going into the medical journey, but they're not majoring in medicine, but they've helped me all these nights, studying for bio, for chemistry, and just like giving me a pat on the shoulder, like, you got this, just to make sure you have people who can support you in your journey and really nourish you. A lot of that also has to do with mentors. Seek mentors out early because it gets hard. And if you don't have anyone to guide you, it's really difficult if when you make mistakes and then you don't realize them until later when it's too late. So I'm so glad I've had mentors who can really guide me and say, no, do this, don't do that, or this is better, don't do this. So, they've lived in your shoes. They know what it's like to be a pre-med. So they can really guide you. And my last tip would be to grow in other areas. Don't just think that, be in this box of just like the pre-med requirements. I gotta get leadership. I gotta get the MCAT. I gotta do these classes. Like it's not just about that. Like it's really about your whole life and like everything that you do outside of medicine. Because when admissions committees come and they ask you questions about what do you do outside of all of this, you got to make sure you can answer that question too. Or you got to make sure that you have a backup plan too. Like it's okay to think of a backup plan, even though you know you want to be a doctor and that's where you want to get, because you never know with all the things happening and so many things changing. It's always good to be prepared in other areas. So make sure you grow other aspects or skills. Do what you want to do, like study what you want to study. Don't just stay in this box because just staying in this box makes you the same person and everyone is going to be doing the same thing. So do something differently.
That is some beautiful advice, and thank you again, Sharon, for sharing your story, your faith, and your commitment to serving your community today.
Thank you so much for inviting me.
Of course.
Of
Um,
course.
it's truly inspiring to hear how your lived experiences are shaping the compassionate physician that you're becoming.
And to everyone tuning in, thank you so much for joining us on the episode today of Vitals and Voices.
If you enjoy this conversation, then be sure to follow, share, and stay tuned for more episodes of Battles and Voices.
We'll see you next time.